Healthcare is currently seeing a dramatic increase in cyber attacks, including disruptive ransomware attacks that interrupt patient care and risk patient safety, as well as impact hospital and health system business operations. It is essential that healthcare organizations understand the current cyber risk landscape and understand that cyber threats are a true enterprise risk. By acknowledging this, they can take proactive measures to prepare for and mitigate cyber risk with focused attention on fast-moving, real-time threats. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle with AHA Communications. Join us to hear insights from healthcare cybersecurity experts and AHA members, including our own John Riggi, who spent nearly 30 years as a highly decorated veteran of the FBI and now serves as National Advisor for Cybersecurity and Risk at the American Hospital Association and its 5,000-plus member hospitals. John and his expert colleagues from Denver Health and Fort Defiance Indian Hospital will discuss how hospitals and health systems can create a stronger cybersecurity posture to protect their expanded networks, their data, and most importantly, their patients and the communities they serve. Today's podcast is brought to you through the generous support of Redacted, an American Hospital Association preferred cybersecurity service provider for healthcare security services and incident response, specifically for small and medium hospitals up to 300 beds.
Thank you, Tom, and hello, everyone. This is John Riggi, your National Advisor for Cybersecurity and Risk. With me today are Randall Fritchie, Chief Information Security Officer with Denver Health. We also have Brandon Benally, Director of Information Technology Security at Fort Defiance Indian Hospital. And we have Tim Kosiba, who has had a long and distinguished career at FBI and NSA and is now the CEO of Bracket F Incorporated. They will discuss the current cybersecurity landscape and how hospitals and health systems can create a healthy cybersecurity posture. Since the onset of the COVID pandemic, hospitals and health systems have become high-value targets for cyber attacks at a staggering rate. Let me start our conversation here. What is so unique about today's cybersecurity landscape that is making healthcare such a desirable target for cyber criminals right now? Tim, why don't we start with you?
Sure. Good to be with you, John, and certainly good to be here with Brandon and Fritz. Today is really challenging. Obviously, we know cyber attacks and ransomware attacks are on the rise. And I think we're seeing it largely in health systems and hospitals because of the value of the personal health information that brings to an attacker or to a group of ransomware attackers, and what that value is on the market today. The information that gathers is just so valuable. It's imperative that hospitals recognize the threat landscape that they pose and ensure that they actually take steps to protect that information.
Yeah, clearly that makes sense as it correlates with the massive increase in attacks even being reported to OCR. Brandon, let's go over you for your thoughts on that.
Yeah, definitely. Thanks for having me. So just to mirror the previous answer, is that for a lot of tribal and rural communities, I think the impact is a bit more severe only because we lack access to not only the proper professionals to handle these cybersecurity attacks, but also the technologies to have them in place. So our problem is a bit different than what you'd get in a larger metropolis area. And plus, I think specifically for tribal communities, specifically our hospitals, is that some of us still do have access to federal networks. So that makes us a more valuable entryway towards staging a larger attack, because we have underserved and understaffed rural communities who have access to federal networks. So the cybersecurity threat landscape for tribal communities is a bit more unique and, in my opinion, a bit more severe.
Brandon, thanks for raising that. That's something that I hadn't thought about, right? Smaller hospital on tribal lands actually could present a outsized risk and impact if you are attacked, and of course the access to the federal networks. The bad guys no doubt have mapped our interconnectivity in healthcare for certain, and you may not be the ultimate target, but you're the pathway, the conduit into the federal systems. Randall, let's go over to you on this question as well. From your perspective, what's unique about today's cybersecurity landscape that's making us such a desirable target for cyber criminals?
Yes, sir. Well, thanks for the invitation to participate today. I think more and more, and certainly within the last 2 or 3 years, I've seen a lot more use of cloud, especially SaaS-based solutions for healthcare. And just by itself, that can create additional risk, especially if you're not sure how it's being managed or where your data is. The additional remote workers that we've had since the pandemic started, I believe creates an additional opportunity for attackers to try to leverage the lack of security for home networks versus, on-prem. I also think there's been a lot of exceptions to standard processes in the last 2 or 3 years that we have put in place because we had to operate in the middle of a pandemic. And we did have a lot of folks wanting to or needing to move to their home, and also the increase of telehealth. And so those two things have really caused us to create some gaps that were required and critical, but still open us up to threats. And I think just increasingly disaster recovery and business continuity, as the ransomware threat increases exponentially, the lack of good DR and BCP planning and the lack of awareness around the operational impacts of those things, I think is increasing every day. And those are the types of things I think that are the biggest threats.
Thanks for that, Randall. And certainly agree that the pandemic caused a immediate deployment of remote and network connected technology for staff, for third-party providers. And as you said, that just expanded our attack surface for the bad guys. And of course, there was no pause in attacks from the bad guys. They saw the global pandemic not as an opportunity for a humanitarian pause, but as an opportunity to increase attacks. Let me move on here. What would you say are some of the more immediate takeaways the field needs to understand to prepare and protect against today's cyber threats? Tim, let me go back to you again.
Sure. I think, as Fritz just raised, certainly hospitals today, given the environment that they work in and the remoteness that you just referenced, it's imperative that we develop this healthy cybersecurity posture going forward. What that means is essentially segmenting out networks where, in fact, life is, in fact, affected by a cyber attack versus the actual mission of the hospital itself. And there are ways of doing that. And there's certainly ways, technology is part of everything today, certainly in a hospital, just like in any other environment. And so we need to approach those security types of segmentation or network segmentation in order to be able to separate that enterprise risk that exists across a hospital. And it is a technology problem, and it can be solved through technology. I think it's important that folks certainly work with organizations that know how to do that.
Yeah, I totally agreed. Brandon, from your perspective.
Yeah, and I appreciate the term of a healthy cybersecurity culture, because what we saw during the pandemic at our tribal hospital and more than likely other rural hospital and healthcare centers was that when we got the work from home or remote work ideas and technologies in place, we're talking about people who maybe travel an hour or two to get to work, and maybe they're at home and they have very slow or very poor internet access. On top of that, my key takeaway is that for tribal community members and people in rural communities who happen to work for a healthcare center and are also lucky enough to have a cybersecurity budget where they work at, there's sort of like a dual role for cybersecurity professionals. So we have our professional responsibilities, which is, of course, is to secure the hospital and its data for the sake of our communities. And then the second role is our community role, being that champion or that advocate for a healthy cybersecurity culture that's outside of our professional roles. And why I say that is because besides just protecting, corporate assets, we have to think about grandma and grandpa who are browsing the internet, or people who aren't as technologically savvy as people in urban and metropolitan areas would be or are. And so my role from that point on is to create that healthy cybersecurity culture through cybersecurity awareness. Besides teaching hospital employees what two-factor authentication is or how to connect to the VPN and so on, but also going out into the community and talking about, predators online or elder scams, things that target our community members who aren't so technologically savvy. So that's my role there, is besides just being a technical resource for my community or for my hospital, is to be that advocate for the community on creating a healthy cybersecurity culture as well.
I think a very unique perspective and service that you provide, Brandon, especially, when we talk about the culture of cybersecurity within a hospital, we all know that really that starts at the top with the leaders. It has to be a priority. The other concept we strive for folks to understand is that to have the staff understand that cyber hygiene is as important as medical hygiene to protect the patients, that this isn't about just protecting data, it's about protecting the patients. And really, I really commend you for going out in the community and extending that culture of cybersecurity to the folks in the community. That's a tremendous service, especially in this day of shortage of cybersecurity professionals, and especially out there in the tribal lands may not have access to professionals such as yourself, the community. Fritz, over to you for any thoughts on this, more immediate takeaways from the field.
Yes, sir. And kind of echo Brandon's situation. Denver Health is an inner city hospital, and we're a safety net hospital. In addition to being several other things to our community, the majority of our business is Medicare and Medicaid, and our margins are so slim that we're constantly struggling just to maintain the budget to be able to operate and provide the world-class services that we're known for. And so that's just an amazing feat that they have accomplished for 160 years. Well, now with cybersecurity, especially over the last 2 or 3 years, they're becoming very aware that cyber is their biggest risk of all. Of all the risks in healthcare, cyber is their biggest risk. And therefore, they have seen that they need to invest in cyber, both from the internal operational type of thing, but also in cyber insurance. And I find that a lot of hospitals, especially smaller ones, they really have not made those investments. So I think the job of leadership, cyber leadership in a hospital, really is to drive increased awareness of the impacts of a breach, to make sure that everybody understands if you can't operate for a month, how will that impact your business and your patients? And I think it's quite eye-opening when they really the light bulb comes on for them, right? And so just the investments that they can make, that drives that hygiene that you were talking about, and the layered defenses that we need, both left of boom and right of boom. And then I say right of boom post breach, we have to have the best, most well-trained operators and the tools who can quickly spot something that just isn't right and go to work on it and quickly stop it. Because the problem is, the old metric from the FBI was 9 months to detect you've been breached. I say we need it in 9 minutes, because these folks get in there and they're in there, and then you lose them and you can never find them. So I think that awareness really, even for smaller hospitals, I think when they get that, I think that's when we start to see a turn in terms of investment in cyber.
Yeah, thanks for that perspective, Fritz. Interesting that both you and Brandon really have similar issues, though, although your immediate surrounding environment are very different, from tribal lands to inner city, but yet as a smaller hospital, critical access hospitals, you're dealing with the same issues in culture and budget and awareness, a combination of trying to apply technology and culture against the problem. So getting back to cybersecurity posture, we hear this phrase quite a bit. Sounds great. We think we know what it means, but I'm not quite sure that many in our audience really understand what that means. We use it so frequently. So this idea of having a healthy cybersecurity posture is critical, but establishing one can be seen as daunting and an unsurmountable task. Again, trying to understand what does that really mean. Where would you recommend the field starts when trying to create their own healthy cybersecurity posture? And Tim, let me start with you again.
Sure. Well, obviously, I think what Brandon and Fritz touched on, certainly on the culture side, it has to start with the people. I mean, the training is imperative. We've seen ransomware gangs and actors get into these networks through phishing attempts and email attempts. So if the training doesn't exist and people don't really know what to look for in those phishing scams, certainly that's a part of the threat that needs to be addressed through education. And so it's awesome to hear that folks are seeing that. But in addition to that, introducing the layered approach, the network segmentation I mentioned earlier, is certainly another way of going about introducing the technology that's available. You can't simply rely on antivirus or anti-malware software on your endpoints. There's technology out there today that allows a lot of automation to be a part of your network that can alert a system administrator or technology that will tell you that certain things are happening in your network that shouldn't be happening. And it's imperative that that become part of your structure and engineering when you're building out your networks, especially since all these life critical components in healthcare today are reliant on the internet. Doing the segmentation and having the ability to address something as it happens, an incident response plan, for example, having that and exercising it so when it does happen, you know what to do, you know how to operate in a manual environment versus your reliance on technology that through an attack like this might not be available to you.
Thanks, Tim. Brandon, your thoughts?
Oh, I agree with Tim. I think the culture, the cybersecurity culture and awareness could be an adjacent goal while you're working on the tactical stuff. Like if people are looking for things they could do now at their hospital or organization is, of course, and I believe in multi-factor authentication, network segmentation, and having strong BYOD, bring your own device policies. Because we see a lot more now that, with the work from home movement and also at the time when there were chip shortages, people were bringing in their own personal devices to connect. So having strong BYOD policies that not only define what you're able to do with device, but also what the organization is able to do with your device if it needs to be investigated, or if a forensic analysis needs to be performed during an investigation. Make sure you have those things outlined within those policies. Some may see it as deterrent for people to bring in their own devices once they see that language. But it also, I think, provides assurances that we're able to perform the investigations that we need to do when a breach occurs. And also, for me, a healthy cybersecurity culture, relies on doing the basics, but also there's so many cybersecurity frameworks out there. There's some specifically for healthcare organizations, such as High Trust and the High Tech Act. Those are ones to follow. There's also NIST and so many others within the United States. And then there's also for international standards. There's ISO 27001 and so on. Those are standards that you could look to help guide you along. What I often tell people to do is to take these standards and find the one that fits your organization the most and will help you to achieve those short-term goals first while working towards the long-term goals of creating a healthier cybersecurity culture or posture, which to me is ultimately resiliency, how quickly you're able to return back from an attack or an incident that had occurred.
Thank you, Brandon. Great words of advice there, especially when we know that, unfortunately, that day will most likely come for all organizations when they're attacked. So having that resiliency is critical. Fritz, I'm going to give you the last word here on this question. Your thoughts?
Yeah, so Brandon was really a good segue there with the frameworks. We really need to start with a framework in mind, and High Trust, NIST, the CIS benchmarks, whatever makes sense. And then inventory and document your data and your assets and your systems. Without that, I always say you can't measure it, you can't manage it. You have to have that critical inventory first before you can think of securing it. Once you have that building benchmarks around how things should be built, how things should be provided access to from an IAM type standpoint, and how a desktop build should be as the standard. And then you can audit against that standard by going through and picking a few systems or data sets and making sure those are to the standards. And then finally, around that, you have to have a very strong exception process, because we have to run the hospital. And sometimes we have to do things outside the standard, and those are completely fine as long as we have a great exception process to document what it is, find compensating controls potentially, document a timeline, an approval, and an expiration date for that exception. And I think those things are all really critical, as foundational when building that cybersecurity posture.
Thanks, Fritz. And Brandon and Tim, thank you all for joining us and sharing your insights today. Fantastic conversations from the technical, tactical, and strategic. And really want to thank you all for all that you do to defend the nation's hospitals and our patients from cyber attacks, which threaten the security of patient data and risk patient safety. And especially thank you to all our healthcare heroes listening today. Thank you for all your dedicated service and sacrifice to care for our patients and our communities. If you'd like to learn more about Redacted, please visit www.redacted.com. This has been John Riggi, your National Advisor for Cybersecurity and Risk. Stay safe, everyone.